Community Medical Centers by Tiffany Camacho, Xiao Fu, Connor King, Amrita Sheen, and Daniel Soto. Community Medical Centers Problem Introduction. The problem Community Medical Centers is faced with is a lack of utilization of its new command center by employees. A three-step system with three sub-goals each has been developed by Team 5 in order to increase usage of the command center. The goal is to implement organizational culture change to maximize command center usage and convince doctors and staff that it will not interfere with the level of care patients receive. Step 1. Define goals. This step includes evaluating problems and goals, clarifying the vision, and clarifying the expected behaviors. The evaluation of the problems facing community medical centers leads us to the conclusion that the old way of doing things was personalized, yet slow and inefficient. The hospital needs to change something about the way employees interact with the new command center to increase the level of efficiency within the organization. The long-term vision of the highest level managers in the organization is to increase the longevity of the hospital by increasing the profitability through efficiency while still administering the same level of personalized care that patients have come to expect from community medical centers. Changing the mission statement to something like, "Our mission is to provide the highest level of patient care through the finest healthcare specialists who administer personalized care and use the latest, most innovative technology to keep our patients healthy," would be a good start to clarifying the vision for employees. The desired behavior change is greater utilization of the command center. This idea needs to be communicated vertically from the top of the organization to the bottom. Step 2. Assigning goals and aligning values. Step 2 involves clarifying priorities, engaging those employed by the hospital, and tracking performance. The priorities are equal parts efficiency and patient care. Employees need to understand that those ideas are not mutually exclusive. A system of rewarding those who more greatly utilize the command center is key to the success of the command center. The entire company, from the CEO to the doctors and nurses, need to be engaged in the organizational change for it to be successful. 50% of the evaluation scale will be efficiency ratings, and 50% of the evaluation scale will be based on level of patient care. We will have the hospital analyze the level of efficiency by comparing each department's current numbers to the numbers from before the command center was implemented. The reason we want them to go back before the command center was implemented is that some departments might see this as unfair, since there was no knowledge of the competition beforehand, and some departments might end up unrewarded for having done such a good job implementing it when it was first introduced. The other 50% of the evaluation scale is to use patient surveys to find reward winners. We would suggest asking questions like, to what degree did your care feel personalized? Would you come back for your possible future medical needs? The hospital should use a Likert scale of 1 to 5. Step 3. Manage. Step 3 includes maintaining the system, managing communication habits, and building motivation within the organization. To maintain the system, the hospital will do mid-level manager surveys every quarter to assess the effectiveness of the reward system we have implemented, and to help identify where the implementation problems with the command center may come up. They will also conduct comprehensive employee surveys once every 6 months to help identify functionality-based problems, evaluate employee morale, and let employees know that their concerns are being taken seriously. There will be people who are experts on how the command center works on call at all times, to ensure there is as little exasperation, frustration, and confusion as possible. The number of experts on hand will be reduced with time as people will start to understand how to use the technology better and are able to help and train each other. Rewards for department managers, line managers, and general staff could be better parking spaces, gift cards, and Department of the Month. Recognition-based items, such as Employee of the Month, will go to those who have thought of new ways to innovate and have brought it to the attention of the managers. This will help increase incentive to innovate. The hospital should also create and implement a hospital-wide reward. They should monetarily reward employees by moving up the timeline on scheduled races or giving bonuses using the initial profits from the increased level of efficiency, only if the total level of efficiency across the entire hospital has been raised to a certain degree. This will encourage employees to think of themselves as one team. It will create pressure to perform or risk being ostracized by the rest of the hospital. We believe this course of action makes sense because it seems to us that it is worth spending your first initial profits investing in your employees, who are some of your primary stakeholders, to establish the behaviors you want to instill. This reward is the primary way the hospital will combat the resistance to change, as outlined in our textbook by psychologist Kurt Lewin. In conclusion, defining goals, assigning goals to individuals and groups, and managing outcomes are the three primary steps required to implement organizational change. Using these steps in community medical centers will bring about the change desired in regards to efficiency and employee morale and attitude. Thank you.